So this, remember the first diagram I showed you? What kind of pain is this? There's nociceptive pain. The pain is causing, infiltrating the nervous system at the brachial plexus, for example. That's why the pain goes to the arm. So it's not just an opioid-sensitive pain, but also neuropathic pain. So then you will use the analgesic ladder. You start with step 1, step 2, and probably in this case, very severe pain. You may want to escalate to step 3 with strong opioids, but don't forget the adjuvant therapy, the antidepressants, the anticonvulsants, or even sometimes other treatment that you can give, non-pharmacological treatment, you can help to relieve the pain. And how about the next case? A 59-year-old lady with terminal CA cervix. This time, this lady is really suffering from the severe neuropathic pain at the pelvis, at the groin, at the perineum, which radiate to the thighs, the legs, and the back. She returned from US, I remember this case very well, some years ago, taking all kinds of drugs that they can prescribe. High dose of morphine, full doses of nortriptyline, pregabalin, high doses of NSAIDs and steroids. She's still crying with pain. So what other pharmacological treatment can you offer? So in this case, remember what I said? If somebody on such a high dose of morphine, what are the common reasons? Maybe the patient not taking the morphine. In this case, not true, she is taking the morphine. But this is the answer number 1. This pain, yes, that's right. I'm so glad you were listening to my talk. So she should be trying some other adjuvant therapy, co-analgesics, and in this case, we titrated up a little bit more on the other painkillers, but more importantly, we rotated the opioid. Remember, opioid works on your receptors on different levels, so it's already probably the mu receptor through the morphine is not working. We change it to another opioid rotation, and for this case, at that time we changed to methadone, and she got much relief from the pain, a dramatic response. And even by doing so, you can later reduce all the other drugs too. And this lady, important to mention too, remember the signs I talked earlier on, not just physical pain, but psychosocial spiritual pain. She was crying, we find out, not just because of the pain. She was crying because she's breaking up with her husband. And she is being uprooted, coming back from US back to Hong Kong with not many friends, family in Hong Kong, with social lack of support. So in that case, we work a lot on the psychosocial support. So it's a multi-modality approach that helped to get her pain much better.